Welcome to those of you who are just joining us. We're going to give a couple minutes for people to get logged on, so please just hang tight. Greetings to those of you who are just joining us now. We're going to give a couple of minutes for people to get logged on, so please just hang tight. All right, I think we'll give it one more minute and then we'll go ahead and get started. Elizar, are you able to pull up the instruction thing that talks about?
Yeah, let me pull that up.
Okay, cool. Thanks. All righty, we're going to go ahead and get started. Hi, everyone. In case you haven't met me before, my name is Hilary Godwin, and I have the pleasure of serving as Dean of the UW School of Public Health. Welcome to our bi-weekly webinar on COVID-19 and the University of Washington's and the school's response to the pandemic. Exciting news, which is that it is actually National Public Health Week. Woo! And oops, I just lost my screen. It's National Public Health Week. And actually Governor Inslee proclaimed on Monday that April 5th through 11th of 2021 is Public Health Week in Washington State as well. So I'd like to start by thanking all of our faculty, staff, and students in the School of Public Health, as well as our community and practice partners for their amazing contributions to protecting the health and safety of communities always, but particularly over the last year. The theme for public health, this Public Health Week this year is Building Bridges to Better Health. Today, we are going to discuss the impact of the COVID-19 pandemic on food security in Washington State. And we are very excited to welcome some of our practice and community partners to the conversation to hear how their organizations are responding to the crisis. Before we continue, I'd like to acknowledge that even though we are gathering on Zoom, we are doing so from Indigenous lands. I'm calling in from the ancestral lands of the Suquamish people. And in Seattle, where many of you are calling in from, we also acknowledge the Coast Salish people more broadly. The Coast Salish people are the original inhabitants of the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. Wherever you happen to be tuning in from, I hope that you will join me in honoring with gratitude and respect the Indigenous peoples who are still here on whose land we are guests. As members of the public health community, we commit to being better stewards of the land we inhabit than perhaps our own ancestors have been, and to partnering with tribes to improve the health of all people and to learn from them. A little bit of housekeeping. These webinars are open to the community at large and really designed to help keep the public health community informed and connected as we work and study remotely. We're thrilled if you're alumni or members of our partner organizations joining us today. But I did want to let you know that occasionally, and I am actually going to do this today, we talk about sort of what's going on at the university and within the school. And so if I make comments about back to work or back to school and you're not primary in the school public health, just a reminder to please check with your own unit or organization to find out what the equivalent situation is there. And also as a reminder, we do not, as you can see on this slide, we do not use the little hand raising function in these slides. It's just too hard for us to track with so many people. And we use the chat function for sharing information with each other. So if you have a resource that you want to share with people on the webinar, feel free to put it in the chat box. But if you have a question that you want to pose to the panelists or myself, please use the Q&A function, and we will endeavor to answer those questions when we get to that point later in the webinar. So at this point, I'd love to introduce our panelists for today. First, we have Nora Frank-Buckner, who's the Food Sovereignty Initiatives Director at the Northwest Tribal Epidemiology Center. We have Jean O'Leary from the WIC program, Women, Infants, and Children, Nutrition, and she is the Nutrition and Breastfeeding Coordinator and Client Services Section Manager at Washington State Department of Health. We have our own Jen Otten, who's Associate Professor in the Department of Environmental and Occupational Health Sciences, and Food Systems Director for the Nutritional Sciences Program in our School of Public Health, and Christina Wong, who's the Director of Public Policy and Advocacy at Northwest Harvest. So before we jump into today's topic, I want to give a quick update on the state of the pandemic, and then, as I mentioned, sort of the impact on UW and SPH operations. As always, our hearts go out to those who have lost loved ones or whose loved ones are currently battling COVID-19. Worldwide, there's been nearly 133 million cases, confirmed cases of COVID-19, and global deaths total more than 2.8 million. As you have probably seen in the news, we are starting to see an uptick in cases here in Washington State and also nationally. And that is obviously causing concern. The drivers of that uptick are probably twofold. They're probably related both to some loosening of social distancing restrictions and other restrictions that we've seen both here locally and across the United States, as well as the emergence and spread of new variants that are more transmissible and also in some cases lead to more severe symptoms of COVID-19 as well. And so we really have reached this point, both nationally and in the state, when we are in a race against time to try and get as many people vaccinated as possible before the variants spread more. So hopefully all of you have seen that the governor has announced that as of April 15th, that all adults in the state of Washington over the age of 16 are eligible for the vaccine. And hopefully you are also seeing pushes from City of Seattle, from Public Health Seattle and King County, from pharmacists, from UW Medicine, from other groups, from our partners, to really make vaccine as accessible as possible to as many people as possible, and particularly to try to ensure that individuals who have been hardest hit by COVID have accessibility to the vaccine. So with that, I guess I just wanted to sort of touch on what you can expect in terms of our planning at the University of Washington. So as you're probably all aware, we are now in phase 3 across the state of Washington in our reopening phases. It's worth noting that the governor, as part of that reopening plan, has said that he will reevaluate phases every 3 weeks, or 3 weeks after shifting into a new phase. And so Monday, we're expecting an announcement from the governor. We don't know whether or not we will have a return to phase 2. It probably depends upon whether or not we see additional surges in cases. But I just want people to be aware that that is one of the things that we're looking at for next week. Regardless, for spring quarter here at the University of Washington and in the School of Public Health, we are remaining predominantly online. So our classes are all online, other than limited classes, for instance, in clinical departments where in-person classwork is required. And we are allowing some limited co-curricular activities. So for instance, office hours in person, group meetings in person for small groups, and only on a voluntary basis. I want to remind people that while there was a message that came out from the central administration saying that people who want to come back can come back, they can only, there was a caveat there, which was if they can do so safely. And we are still working as a school to ensure that our facilities are ready and that we have the systems in place to be able to accommodate those folks who are non-essential workers but want to come back. So please coordinate with your department administrator if you want to come back, but you don't need to come back, so that we can start working you into that planning process. You probably have, if you're at the UW, you probably have also seen messaging coming out from Central indicating that we are really hoping to be back almost entirely in person in the fall. And I wanted to make sure that people heard loud and clear from me that that comes with a big caveat. So we absolutely are planning that. And so you will see in terms of your time schedules, if you're teaching a class or you're signing up for classes, that they're scheduled in rooms that assumes no social distancing and in-person classes. And I just want to clearly state that while that is the planning scenario that we are using, that we will only do that if that is consistent with public health guidance at the time the fall quarter starts. So if public health guidance, either Public Health Seattle and King County or Washington DOH, suggests that that is not safe, we will not do that. So I know people got really anxious when they saw that because we're clearly not ready to do that now. I actually think we're on a good trajectory, even with the variants, to get there. But I just want all of you to know that there's a lot of things that need to happen between now and then for us to get to that point. So we are planning for that, but we're also doing contingency planning and realizing that we will need to pivot if things do not get to where they need to be in order for us to return in person in the fall. So those were the main things that I wanted to cover. We are doing a bunch of listening sessions this week. We've done a couple with students already, and then we have ones coming up for faculty and staff. We want to hear from you. I want to again reinforce that we are doing everything that we can to make sure that you can return safely and that the appropriate precautions are in place. And you're going to see us sort of holding you back on returning until we get those systems in place. Okay, so with that, I am going to switch gears and let us move over to our guided conversation with our panelists. So Jen, I think you're first up. So I'm going to turn it over to you and let you sort of introduce some of the work that you and your team have been doing. So thank you for being here.
Great. Okay, finding all the windows again. Great. Well, we're going to share with you a little bit about food security today, specifically in Washington State, and what's been going on during the pandemic. And early on in the pandemic, I think it was really clear that food access and food security were going to be challenging. Most of you saw it with your own eyes when you walked into the grocery store and saw food shortages right at the beginning. And then you saw, grocery stores and food banks and other food access opportunities start limiting their opening hours for various reasons, or limiting the number of people who could be in the building at the same time. And then at the same time that all of that was happening, people were losing their jobs. And so we knew that food access and food security were going to get even more challenging. We just didn't know kind of what the roller coaster was going to look like. And so we wanted to try to help by tracking these changes over time. And at the UW and WSU, and we worked with Tacoma Community College side, we wanted to launch a survey to really better understand the impact of COVID-19 on financial and food security among Washington State residents. And so I have points to tell you a little bit about, what we learned from some of these initial surveys, but I think it might be interesting to kind of hear maybe just a first take from everyone in terms of, it kind of hear their, the space they're situated in too, before we kind of start sharing results and whatnot. So I don't know who wants to go first. Christina's the next one next to me.
Yeah, sorry, the little gap there. Yeah, Christina, maybe you can talk to us about how Northwest Harvest and its partners have responded to increasing food insecurity in the state.
Sure. Well, thank you very much. And I feel like I can't really start off without saying a huge thank you to Jen and her team, because the survey information has been invaluable to us in all the work that we're doing, whether it's analyzing about what are the new programs we can do to get food to people where they are, all the way to our public policy advocacy, which is the space that I primarily work in. But as Jen was saying early on in the pandemic, that we saw food insecurity. It felt like it skyrocketed overnight, and at the same time, we were looking at new guidance that we had to put in place to help minimize in-person contact for people, and also looking at a sharp decline in volunteers, because primarily food banks rely on senior citizens and people with disabilities, people with their own people that they're taking care of, but really people who are in high risk categories for more severe impact from COVID-19. So a sharp decline in volunteers as well. And then we also had a limited supply of food, because a lot of what food banks have been doing in the most recent years is to really shift away from what people think about. You think about boxed mac and cheese and canned meat products, but really trying to put more emphasis on getting fresh food into the system. None of that was initially available to us at the beginning, because what we were trying to do was to help people who, just like everybody else who was stockpiling on shelf-stable food items in case they had to quarantine and shelter in place for a while. We had to, we couldn't use a lot of the food that was in our warehouses, which was fresh and frozen food, and had to find more of those shelf-stable foods. So in that first phase of COVID, what we did was we partnered with the Feeding America affiliates in our state, which are Food Lifeline in the West and Second Harvest in the East, and also the State Department of Agriculture. And we divided up the state into 13 counties that each of our organizations was responsible for putting our resources into. And we pivoted away from giving pallets of mixed food items so that frontline food banks could offer those as choices to people, to pre-packing shelf-stable food items into boxes. So that way, frontline programs who had limited volunteers to work with could take boxes and either do home delivery programs or walk up and curbside pickup in order to minimize that time that people were spending indoors. So after that first phase was over, we were able to start gradually reintroducing fresh food items back into the food that we're distributing. For Northwest Harvest, one of the things that we're really proud of that we were able to do was partner with Anaba Farms, which is in the Yakima area. They produce these beautiful, kind of still sticking with that pre-packed model, but CSA style boxes of mixed produce that we were able to distribute throughout the state. And we actually saw a lot of these partnerships because in the news, we all heard these stories about growers who are having to, slaughter pigs or dump milk down the drain, food that had been raised specifically for contracts for our hospitality and our restaurant industries. A lot of people would hear those stories and say, well, that food shouldn't be going to waste, but people need to understand that there are different supply chains, food that's packaged and processed for different purposes. And so in the emergency food setting, with the help from CARES Act funding and our State Department of Agriculture, we saw a lot of our partner programs, again, shifting and partnering with local growers and then unused spaces like closed school kitchens that weren't being used and displaced restaurant workers, able to buy up the food that had been grown for these contracts, and instead of putting it to waste, processing it into soups and stews that were made in these kitchens, put in the freezer, and are now available for distribution. And then quickly, just some other things that we did in order to shift how our approach to work. We were also looking a lot at what were the limitations on access to food banks. People either not able to get there because there's limited public transportation that they relied on. Also, the need was so great, but food banks might still have policies in place around the number of times that people can access, can go to that food bank program. So we saw a lot in the community, particularly in Black, Indigenous, and communities of color and immigrant communities, these community responses of people who weren't previously in the business of distributing food, but trying to get food to people in their communities where they are. So that's also led us as an organization to finding new partnerships, opening up things like we have a harvest pantry where those programs who are not food bank partners of ours can come in and get food for free to help with their distribution processes. And we're also looking right now about how do we shift our resources and build some more inclusivity into those existing resources that for hunger relief organizations to accommodate these programs, because frankly, they're going to be doing this work for the long haul. The last quick piece I wanted to mention around our direct distribution piece and how we shifted was we were also really proud of having launched a grocery gift card program that partnered with BIPOC organizations working with BIPOC-owned businesses in their communities, usually smaller grocery stores, to provide grocery cards for people in those communities to get more culturally responsive food, and also as a way to help support those businesses in their communities. We figure that doing what we can to put resources for people before they have to come to the food bank helps take pressure off of that food bank system, which has had to grow and expand, but we want to make sure that people can have those opportunities where they can have the choice and the culturally responsive foods that they both want and need. And that's why also through our advocacy work, we've worked a lot with federal advocacy down to the state and trying to do even more outreach to help connect people to programs like SNAP and WIC and the Pandemic EBT program. All of those really have to go hand in hand because charity can't do this work alone. So really trying to get resources, whether it's food and meals itself, or also access to those resources that people are eligible for, helping to break down those barriers for people in order to access them. So the two go hand in hand in order to get more food on the table.
Thanks, Chris. Nora, I'd love to hear from you about how you've seen the pandemic impacting the communities that you serve and what your organization's been doing in response.
Great, thank you. Hello, everyone. Thank you for having me today. And just to back up one step, I'm Nora Frank-Buckner. I'm a Nez Perce tribal member. I'm a Klamath tribal descendant. I grew up in Southern Oregon and Klamath Falls, so close to my Klamath relatives. I've lived in the Portland metro area. Now I live in Vancouver, actually, Vancouver, Washington, for, since 2011, I believe. And I work for the Northwest Portland Area Indian Health Board. And within that sits our Northwest Tribal Epidemiology Center. And just for quick reference, that we are a public health authority that serves our 43 federally recognized tribes of Idaho, Oregon, and Washington. So we are a regional sort of organization that focuses on many different public health initiatives. And so food sovereignty, food systems work is quite a newer one based off of some work we were doing and still do with the CDC for good health and wellness in Indian country that has a strong focus in that upstream public health framework, which I know the School of Public Health is going to be like, oh yeah, I know, policy systems, environment change, all that jargon in real practice for chronic disease prevention in our tribal communities. And so it wasn't surprising that the tribes that we have been working with focused in on food systems work, food sovereignty work, when you're talking about chronic disease prevention for so many different diseases. So that was just a quick elevator speech of our organization. And so, yeah, very similar to what just Christina just gave a great overview that, you know, nationally within the first week of when the country was starting to close down due to COVID, the food distribution program on Indian reservations, so FDIPR is an acronym we use a lot, they were reporting that they had over 600 new households sign up for services within 50% of their, or in 50% of their Indian tribal organization sites. And the food take rate was rising, the food inventory was depleting, saw very similar supply chain disruption happening and ordering issues from those national warehouses. And then regionally, we were seeing an increase of that food assistance need and food access being an issue, similar to what we were seeing nationally in tribal communities. In particular, when you start talking about traditional foods and medicines and cultural relevant foods, I think that it was really case by case, tribe by tribe, family by family situation. Some tribal programs were able to continue offering some of those traditional foods and medicines within their food delivery boxes or through their health clinic programs. And there were families and young ones who actually, you know, would step up and go do that gathering, that hunting, that fishing for their elders and deliver that food to them, just so that their elders, you know, could stay home, stay safe. So we've seen that continue as well. One thing that I do think has been extremely difficult across the board for our tribal communities when it comes to those traditional foods and medicines is a lot of that comes along with ceremony. So we usually have a lot of first foods ceremony depending, you know, where you're from regionally. So that those foods will be different, but those tribal practices, those ceremonies often take place in large community gathering. And so the hard decision to cancel those or to put them on hold or only do them family by family, you know, that was really hard for tribal people to do. So much of our food and our culture, those ceremonies are extremely important when we're talking about our holistic health, physical, mental, emotional, spiritual health and well-being. So that was really hard, but tribal communities did it because we're trying to keep everybody safe. As far as a organization response, we had a lot of funding set aside for a lot of in-person meetings, in-person gatherings. I facilitate and coordinate the Northwest Tribal Food Sovereignty Coalition, and we do an in-person gathering. We had all these field trips that were planned that we were going to do, so none of that happened. And we reallocated those funds to just go directly to tribal communities to support some of this food distribution work. And yeah, it felt a little bit like a quick bandage because it's not enough. It's, you know, bigger systemic things that we're trying to work on to fix some of this. But we did some of that with funding. We're working with UW, which we'll talk more about, on a food security during COVID-19 survey for our tribal communities that will provide more of that data that's tribal specific that we can use and our tribes can use to do more of that policy level change. So advocacy of resources and funding. Just like Christina said, those policy level changes really matter. So that's kind of been my ongoing efforts as far as working with our Northwest Tribal Food Sovereignty Coalition, as well as the Food Sovereignty Subcommittee that we hold with the affiliated tribes of Northwest Indians. I don't know how many of you are familiar with that, but I'll just say it's a consortium of our Northwest tribe, tribal leaders that meet on various aspects of our different topics, whether that's education, health, transportation, natural resources, you name it, that do a lot of policy and advocacy work that goes straight to the national level and influence that federal level policy. And so that's where we really rallied together and do that partnership building, like Christina was saying, so important. And within the last year, I've had so many new partnerships come to our coalition, not just tribal, but with our non-tribal ally partners and resources. Northwest Harvest has come up so many times in conversations, as we also did work with Anaba Farm in the Yakama Nation. Anyway, so partnerships have been crucial to our response in just food security. We had a whole nother COVID-19 incident command center response that we have ongoing, but I won't talk about that. I'll stay focused on the food system piece. But anyway, yes, so that's all I have.
Thanks, Nora. That was super helpful. That was a great overview. Jean, would you like to tell us about what you've seen in terms of folks who are receiving WIC support, maybe some of what the most concerning food security related implications are, and what effective approaches you've seen DOH been able to employ?
Sure, and thank you everyone for for inviting me here. This has been really interesting. Like what Christina and Nora said, our clients are running into, and I gotta let my cat down. Running in, our participants ran into food, empty grocery shelves right away, and so and we were constantly on the phone with USDA, letting them know what the issues are, and our partners at USDA really moved quickly to issue us a number of waivers, because we were not only concerned about our clients getting access to food, we were concerned about how WIC services could continue so that clients could continue to receive benefits in a way that left our participants and our WIC staff safe. Very concerned about that. And so we were able to get a number of waivers. The WIC program's heavily regulated, so a number of waivers around physical presence and what kind of documents we needed to see so that our local WIC staff could continue to see participants or provide services remotely. A lot of it's done over the phone. We provided a platform for them to use if they wanted, if the WIC families wanted to engage in a video chat. It was totally up to them, but we wanted to provide that option for local WIC staff as a way to connect. And we also worked and changed our policies around the type of breast pumps that we were issuing. Instead of multi-user breast pumps, we issue just a single-use breast pumps, so to ensure, again, safety. And then we looked at our food list, and so the waivers that USDA has provided us will run 30 days post the end of the pandemic. And so we had to carefully consider what foods we offer on our food list, not knowing how long this would last. I think it lasted a lot longer than we all thought, But we wanted to ensure that participants had access quickly, that we weren't putting foods on one day and taking foods off the next day, and having the clients being able to scan one type of food one day at the grocery store and another day, next day not. And then we also have constraints with what foods we are able to add with our software that we use, because there's some programming involved in that. And so with those constraints, what we did is we kind of optimized our food list, and we added about 600 items to just ensure the availability of different products in different packaging sizes. And then we decided to keep within the current federal regulations so that, again, we weren't adding foods in and then taking them off and creating this, kind of a yo-yo effect at the checkout stand that we really wanted to avoid.
Jen, if you're willing, I'd love to come back to have you talk a little bit about the survey that you did with your partners and insights gained from that survey, because it was so powerful.
Yeah, and I thought it would be better received once everyone had kind of given, painted the picture of what happened. So this survey, wave 1 was in the summer of 2020, and wave 2 was this past December and January. We had really great reach with the samples, largely because of working with partners such as those on this webinar. But we reached out to 300 plus partners across the state and community organizations, public health, local jurisdictions, and whatnot, trying to get them to see if they could put on their social media or via their networks. And so we had great sample coverage. We got 38 of 39 counties in Washington state. And I would say the highlights are really around kind of food security, diets, and then participation in food assistance programs. So with food insecurity, what we've seen in wave 1 and wave 2 are a prevalence of 30% in both waves. And there's been clear disparities by income, respondents of color, respondents with children, and many other vulnerable populations. And in fact, in some of those categories, we see almost 60% food insecurity. So like in the lowest income categories, about 60% of them are experiencing food insecurity. And that rate didn't change from wave 1 to wave 2. We also saw that the food insecure households had, they gained more weight or reported gaining more weight. They reported having greater stress, anxiety, and depression than food secure households. In terms of diets, so this will be reflected kind of in all the comments that the other speakers have made. Food insecure households, they reported reduced access to kind of the fresh foods, the produce, and also they reduced their expenditures both at the grocery stores and in food away from home, much more than the food secure households. And then finally, you heard a little bit about all of these food assistance programs, and we saw in wave 1 that about 1 of every 3 households was participating in food assistance programs. By wave 2, that had increased to about 40%. And when we cut the data and just looked at food insecure households, participation in food assistance programs from wave 1 to wave 2 went from 59% to 71%. So about 3/4 of our population was participating in some type of food assistance, like women, infants, and children, or summer school meal programs, food banks, supplemental nutrition assistance programs. So, we could definitely see a lot of the changes that were happening on the ground. It was surfacing in the data and what people were reporting that they were experiencing, and kind of, it's clear from wave 2, and then kind of we're thinking, we're about to go into wave 3. That what Chris said about this being a long-term problem, it definitely looks like it's going to be a long-term problem, and history tells us that as well. With the 2008 recession, even as the economy was recovering, we were seeing year-over-year increases in food insecurity. So we hope to be capturing this information for some time to come to watch the trends over time and what's happening.
We're starting to get a bunch of questions in the Q&A. So instead of going with our pre-planned questions, I think maybe we'll shift over to those. One question that came in was just sort of a general question about, I think for organizations that provide relief, when you use gift cards, are there restrictions that in terms of what kind of foods can be purchased or what kind of items can be purchased with those cards. Chris, maybe you want to answer that one.
Yeah, sure. I accidentally hit the Q&A button instead of unmuting myself just now. So with the gift cards, we tried to do a mix of, there were cards that were specifically grocery vouchers at but at BIPOC-owned stores, no restrictions as to the types of food that were being purchased. And then we also tried to do straight up cash cards that could be used with more flexibility, because that's really the goal that we want to get to, is really human-centered and recognizing that families make choices that are best for themselves. There's an inherent dignity in that. So try to do a mix of both straight up cash cards and then specifically grocery, but within the grocery, no restrictions like you can only buy produce or whatnot, things like that. That said, we are also partners with the Department of Health in the different SNAP match programs that are being operated through the Fruit and Vegetable Incentives Program, which by the nature of the federal funding that is used to support most of those programs is specifically around produce. But in the opportunity for us to create our own program, we didn't want to put those same restrictions.
And Nora, I see that you answered the question from someone asking about sort of in a similar vein about loss of ceremony and ritual affecting groups within the tribal community. And in that case, asking whether some of the foods from the redistributed funds have been spent directly on ceremonial foods that are sent to the people who use them, or are the funds instead sent to recipients so that they can purchase their own foods according to their preferences and depending upon supply. And I thought others might be interested in here. Unfortunately, with this way the Zoom Q&A works, when you answer something, it's like it disappears. So I just thought other people might want to hear your response as well.
Sure. It was a great question, and both was my answer. So yes, and more. So some tribes chose to use the funds for traditional food. Some chose to use it for their community gardens, which might have more conventional, produce in it. Some spent funds to purchase seeds or supplies for doorstep garden delivery. Some used it for simply gas for the ones who are delivering the food to the community because they're volunteers. So there wasn't a really big restriction on how tribes could use these funds. And so all it was to support the food sovereignty or system work that each tribe was working on, distribution, access, all of that. So it like I said in my response, is just that you can imagine how creative each community can be when you let them decide what's best to serve their community. So yeah, it's amazing how that works. And it worked out that way because the funds I was using were foundation funds from the Native American Agriculture Fund. That funding is a lot less restrictive than you might think of if you're using federal dollars. So if it were federal dollars, there probably would have had to be more restriction on how the money would be spent. But this was a little more flexible. So that was good. That was a good thing.
Yeah. We have another question, one wondering, in the 3-state region, how many tribal communities have WIC programs operating on tribal lands or in conjunction with urban Indian program locations?
I don't have that number in my head, but we have the Seattle Indian Health Board. Then we have multi-tribe organizations like SPIPA, Puget Sound, intertribal organizations, and then several programs, Yakima Indian Nation, Colville Confederated Tribes, which is a consortium of different different tribes and then small tribes. I'm excited. We're just going to be starting a program in Tulalip for the Quileute. So I'm excited about that. And so we have a number of tribal organizations. And then I don't know about in the 3-state area, I'm assuming that might be to the Northwest. So it might be Oregon and Idaho, and I don't have that information.
Understandable, given that
Yeah.
you're
Yeah.
And neither do I. I'm sorry.
Oh, you don't? Okay.
No. I'm like, oh, that would be good to have that number, but I don't have it off the top of my head.
Yeah.
Nora in Portland, I think, does, and ANEA, I think, the Native American Youth and Family Services.
Yeah, no, I don't either. And I actually don't have the number even, I'll maybe try to pull it up right now while we're talking, but oops. And we've done some work with the Northwest Area Indian Help Board with, yeah. So
Like,
actually it's good, excited to see your face. So we've done
worked
some
with our Breastfeeding Initiatives.
right.
project, which is part of the same, yep.
Yep, the Weave Grant. So what we've done is we've taken a USDA peer counseling program and worked with a really experienced trainer to team up with area food sovereignty experts and create a program that's really tribally driven. And I've been to a couple of those programs, and they're powerful. And I feel really privileged being there.
Well, we really appreciate you.
I hope we can do more.
Yes.
Right on.
Here's sort of a different question. This is one, it says to all of you. How have supply chain issues, both for your suppliers as well as your clients' grocery stores, how have those been impacting your organization's decision-making and programming?
I'll just tell you kind of an interesting story right now that's just as an aside from the pandemic. And maybe, Christine, I'd be curious to hear what your experience was from the storms in the Midwest. And it just gives you sort of an understanding of how interconnected the food systems are in just a really interesting way. So the storms in Texas disrupted a lot of manufacturing, and there was a manufacturer in Texas that creates all the resin that Dairy Gold uses for their containers. And so as a result, and Dairy Gold makes not only Dairy Gold that you see in the grocery store, but they make, they do the packaging for Food Club and a number of other brands. And so they were stopping for a while the distribution of 1% milk in, it was carton, it was plastic. And then there was another issue in an Idaho manufacturer that was hitting the cartons. And Dairy Gold is a really popular choice for WIC participants. And so we had to do a lot of quickly move to let stores, staff, participants know. Our participants have a shopping app, which 90% of our families use. It's called the WIC Shopper app, where they can scan products. And we're also fortunate to be able to do a banner kind of notice on new things. And Jen knows about this because we use this banner as part of the work that we've done with on the HER grant. And so, yeah, and just a part of that's just from a storm. So I don't know, Christina, I'm just curious if you ran into something because of that as well.
I wish I had a good answer for that. Our procurement team would probably have a better answer on that specific item. But I mean, in general, I can say as far as COVID is concerned, for us, particularly at the beginning of the pandemic, we were having to buy a lot more food again because the fresh and frozen product that we had in place wasn't initially usable, and everybody, like not just food banks, but also grocery store retailers, where we were in competition with them because everybody was trying to buy those shelf-stable food items. And so it really drove costs up for us as well. I think the figure that we were using was, for every dollar value of our food, it was 90% was donated, 10% was purchased, and that flipped for us at the beginning of the pandemic. The other thing I'll say as far as disrupted supply chains are concerned, Washington State, we are really uniquely positioned compared to other states. Our State Department of Agriculture houses both the food assistance programs, which is supporting our food banks, as well as what's called the regional markets team, which is staffing and programming in place to help our growers be able to have diversified marketing opportunities. So, we really were uniquely positioned, I think, in having one department that has that expertise in both of those areas. So in addition to some of the examples I was talking about, how CARES Act funding was used to bring to purchase local produce, we also saw things like CARES Act funding being used to rescue airline meals for distribution, so that there are ready-to-eat meals that were being distributed through food banks. We also, I think, when you look at, I think the statistic is something like, before the pandemic, 40% of the food supply chain of food coming out from Washington State was for that hospitality and restaurant industry. So that's why there's been a lot of this emphasis on what can we be doing to help support those smaller growers who were really, really hurt by those lost contracts, but still make good use out of that food. So that's also taken us to a place at the state and the federal level. At the state level, for the 21-23 biennium budget, we have been advocating for more funding for the State Department of Agriculture to keep being able to do have this flexible grants in order to create more flexibilities across supply chains. And then at the federal level, we've actually been doing a lot of advocacy. Traditionally, food banks get federal commodities through the Emergency Food Assistance Program. We've actually been doing a lot of advocacy about USDA giving more flexibility to states, so that we could do things like those USDA food boxes, but here in state, so that it's also stimulating local food economies.
Yeah, and Hilary, I just want to jump in, and Sarah Collier, another faculty in our unit, did a survey with WSDA and WSU on how farms and ranches were impacted. So just to kind of like tie the other end of the story, and I've put links to those report briefs in the chat, so if people wanted to take a look at those. But I was also on a panel with Scott Owen from PCC, which is a grocery store, if you're not familiar with the Seattle area, a grocery retailer. And I found it so striking. He was talking about, just like food insecurity is going to be continuing on for some time, food supply chain disruption is as well. And I hadn't really thought about this before, but, he was talking about how just as the vaccines roll out differently in different countries, or as outbreaks happen differently in different countries, it affects our global food supply chains constantly. And so there's just this constant fluctuation right now for the grocery retailers as well, that he thought would last for many years to come. So, yeah.
We also got a question that it says Chris, but I think maybe Jen, this might be for you to talk about a little bit about differences and trends that you saw. Well, one was pre and during pandemic, and then the second one was differences and trends in participation in food banks versus other forms of food assistantship.
Yeah, we saw, so just from before COVID to the first summer wave that we looked at, food bank participation skyrocketed, and some of the food assistance programs appeared to not change very much from pre to post, but a lot of that was what was really happening was everyone was having to figure out how to shift to remote services and sign people up remotely, or you know, how do you you know, get into the programs who maybe didn't have a website for this before? So suddenly they're having to set up a, you know, a website for people to enroll. And so now in wave 2, we haven't done the full data analysis, but it definitely looks like the other food assistance programs have seen quite an increase by winter 2020 or early 2021. And we'll have a report brief out on that fairly soon. Yeah, but yeah, there were definitely, it's definitely been kind of this roller coaster shift in terms of how people have been able to use that, those programs and whatnot.
Yeah, I think a large contributing factor to that is the the policy, or sorry, the waivers that were put in place that have opened up access and participation, given more flexibilities, right? I mean, as far as food banks are concerned, pre-pandemic, the WSDA was saying that 1 in 6 Washingtonians rely on a local food bank, and now that need has nearly doubled. Anecdotally, we've heard from partners throughout our statewide network that the increase in their lines has been anywhere from 30% more to 300% more. And some of the things that we're also seeing, like in the areas where it's on the lower end of the increase, our food bank partners are saying that that they're hearing more from clients that they've enrolled in SNAP. And so it's showing exactly what we keep promoting, is that dynamic between when you use SNAP and you use your food bank, and using, you know, getting SNAP could often, you know, can sometimes help people not have to, well, depending on your financial situation, right? Either not have to go to the food bank, or it's still supplementing what you're getting from the food bank. But definitely the different federal waivers that have been put in place have helped open up access. So, you know, or the attractiveness of applying for programs. I think there's a lot of stigma that's attached to it, but, you know, certainly with the different COVID packages that have boosted SNAP benefits for people. So it's more worth their time to go through applying. That's certainly helped encourage people to apply. The school meal distribution sites that Jen had mentioned that more people were participating in, you know, key to that is that those sites, unlike when meals are offered in schools, when during COVID, there's been waivers in place that are using a different federal funding stream. So those meals are available to all kids under the age of 18, and you don't have to show any proof of income eligibility or personal identifying information. That's also been a limiting factor, is any programs where people feel like they have to give personal information. And that's a lingering impact of the last administration's efforts to limit access to SNAP and housing and Medicaid through the public charge test. So those are all things that we, looking forward to the future, are trying to continue to build trusted messaging about, to help people who are eligible for these programs get through any fears or misunderstandings about it, so that they can actually access them.
Can I just add, and Christina, thanks for that. WIC is not under the public charge, specifically exempt. And so, and then one thing that is coming up too is with the CARES Act for WIC is we'll be increasing our thinking about the attractiveness of the food package, increasing our cash value voucher for fresh fruits and vegetables up to $35 per participant. So that'll be coming, it's for 4 months. So we're projecting a June through September change. So we'll be getting more information out to spreading the word out about that as soon as we get it available.
Yeah, it coincides right with farmers market season. So we're going to be we'll be happy to help you spread the word.
That's great. Yeah, we're going to try to do the promotion in a way like to, use your farmers market values or benefits to do, buy local and seasonal, and then your WIC for other kinds of fruits and vegetables and frozen fruits and vegetables. We're going to try to do the, a combination where we're promoting both, right? Mm-hmm.
So we are actually, the time just went by like that. This was such a great conversation. We are coming to the end of our hour, and I wanted to thank all 4 of you, certainly for the time that you spent with us today, but also just for the really transformative work that you've been doing during the pandemic to support communities. So thank you all enormously. Really, really appreciate it. For people who are on the webinar, last couple of reminders before we go. Tomorrow is Husky Giving Day. So we hope that you will help to rally support. We're raising money for our students. So if you could spread word through your social media channels and tag UWSPH on Twitter, Facebook, Instagram, that would be awesome. Obviously, if you're in a position where you can make a gift, we would love for you to make a gift of any size. And other announcements. So we're coming to, it's hard to believe, but the end of our first year of our new strategic plan. And so we just launched a survey yesterday that will continue through April 22nd. So check your email for the link, and it probably will be in the chat box briefly as well. The survey is to establish baseline data and also on the plan's key outcomes and get your input on our progress to date. So we really want you to weigh in on that. Our 23rd annual MPH Practicum Symposium begins next week on April 13th, which showcases our MPH students' work to address real-world public health issues, including but not limited to COVID-19. We have it stretched out over several days because you can't sort of see multiple people at once like we could when we're all in one big room together. So please log on and join us when you can. And last but not least, I have exciting news, which is that one of our own doctoral students, Dorothy Thomas, it has just been announced as the school's 2021-22 Magnuson Scholar. So big congratulations to Dorothy. And we will obviously have there's a health sciences announcement that's up on the web, and that's probably in the chat as well. But we'll also obviously push out a feature story from the school as well. So congratulations to Dorothy, and she does amazing work. So super well deserved. And thanks again to our 4 fabulous panelists for joining us today and for your great work. Really, really important. Thank you so much. Bye, everybody.